My name is Jackson Law. I'm a podiatrist and I work here at Wallowa Memorial Medical Clinics. I completed medical school at Midwestern University in Phoenix, Arizona, and after that went down to Tucson and completed my surgical residency training at the Tucson VA, and I worked with a lot of different podiatrists and foot and ankle orthopedic surgeons in the Tucson area during those 3 years of training. I specialize in treating problems with the foot and ankle. A lot of times it's really straightforward. I might get a referral from a primary care provider for an ingrown toenail where we take that out, but a lot of times I'm evaluating for some unknown foot or ankle pain that's been going on for a month or a few years. And so yeah, a lot of evaluating, doing different tests, and then we kind of work together and try and make a game plan, go through what we can do conservatively to try and help out the problem and help the pain go away. And if there's surgical corrections that need to be done, then we discuss those as well. We see a lot of different things in podiatry. The most common that we see, plantar fasciitis, which is a pain in your heel. We see a lot of nail fungus, which is pretty gross and people can be embarrassed by, but is super common. A lot of ingrown toenails, as well as oftentimes a lot of sports-related injuries or work-related injuries, broken toes, broken metatarsal bones, broken ankles, and then just random foot pain that you don't know what it is. It's been there for maybe a month or a year and it won't go away, and you need help figuring it out. So yeah, treat a lot of just general foot pain and help diagnose what's going on with that. I like working together with my patients after we figure out what's going on. Through physical exams, sometimes looking at x-rays or needing to order MRIs. Once we figure out what the problem is, we lay out all the different treatment options, and I like starting most conservatively. Sometimes that's by putting a special pad on your insert to try and offload a certain area, or referring to physical therapy, or getting you started with icing or stretching. And then oftentimes if that's not working out, or if your pain's really severe, we'll discuss doing steroid injections that can oftentimes help decrease pain and get the ball rolling pretty quick, depending what the problem is. And there are certain situations where we discuss surgery and certain things that can't be fixed clinically or conservatively. And so I like talking about the game plan for what that surgery would entail, how long you'd be off, what the recovery time would look like, and the benefits to you long term, and if it'd be worth it for you or not. And so I like having good communication with my patients to see what they want to do and what's going to work best for them. There's not a ton of it because my wife and I have 2 little boys, but we love spending time with them. As a big reason we moved here is they both love hiking and camping and playing in the dirt and the mud, and in Arizona we had to drive pretty far to do those things, so we love just being outside and doing anything we can with them. And when I do have free time, I really enjoy playing sports. My favorite's volleyball, but anything I can do to disguise that I'm getting exercise in, I really enjoy. I also really like watching sports. Love the NBA and college football are my 2 favorites, but also I'll watch any sports that I can. Usually it's after bedtime. So I'm a big Phoenix Suns fan, and I went to BYU, so I really enjoy BYU football and basketball. I've loved my patients. They're kind and they're appreciative. Many patients have expressed how much they appreciate not having to drive 2 or 3 hours to see a different podiatrist, and everyone loves feeling appreciated, myself included. So it's nice coming to work and having people treat me well and be kind, and so it's a great environment. Having foot pain is normal and common, but that you don't have to live with it for the rest of your life. And that I think it's worth taking 30 minutes out of your schedule to come in and be evaluated and see if there's something we can do to help you out.